So another new great modality that's out there that I'm seeing a lot of is dry needling, and I personally don't have any experience with it. I'm really interested to hear kind of your story of it. I know you teach it regularly with your courses, and it's something that I've had done to myself. My wife is certified in dry needling, and so I think that there's some benefits to it. But tell me a little bit about how you came about to start with dry needling, and kind of what are its benefits? What can you tell me about it?
Yeah, I started utilizing dry needling probably around 2008, 2009, and really just sort of studied and took many different classes over the course of several years, and sort of had the opportunity to create an education company last summer. And so now really teach about dry needling and how I utilize it within my clinical practice, both as an athletic trainer and as a physical therapist.
Mm-hmm.
And yeah, exactly like you said, like I've had some really, really great results with it.
Yeah.
It's been one of those things that has definitely been practice changing for me. I know we don't exactly know how it works or why it works, but we certainly know that it can work.
Mm-hmm.
And I think that it's important to make the distinction between dry needling and acupuncture.
Yeah.
You know, everybody kind of asks that question, and you know, acupuncture, when you look at the root words, acu is sharp and puncture is to puncture. So are we utilizing a sharp object to puncture the skin? Yes, we are. And so, you know, traditional Chinese acupuncture, under the description of traditional Chinese medicine, that's really where acupuncture comes from and is often rooted in traditional Chinese medicine. And then from that, there's so many different offshoots and specialties of traditional Chinese medicine and traditional Chinese acupuncture. And there's Western medical acupuncture, and under Western medical acupuncture, there's even more subcategories. And dry needling is one of those categories. So I think I'm a real huge advocate that the tool does not make the professional. Each profession, whether you are an athletic trainer or a chiropractor or a physical therapist or an acupuncturist, we all have overlapping skills. We all utilize manual therapy, we utilize exercise, we utilize taping, and a fine filiform needle is no different. It's just a tool that overlaps multiple healthcare professions, and we utilize it in very specific ways based on your education.
Right.
And so I'm certainly, just because I use a fine filiform needle does not make me an acupuncturist. Just like when I utilize a manipulation, I don't magically become a chiropractor either.
Right.
So, you know, the tool does not make the profession, and I think it's important to note that.
You know, one of the things that I think a lot of younger therapists don't know is that dry needling was popular back for many years in the 70s with Dr. Travell. Remember?
Yes.
The myofascial pain. That's the way Dr. Travell treated a lot of trigger points. And medically, they've treated trigger points for years and years and years with really great success. So I know that it's a great modality that we can really use in our clinics, and I appreciate all you're doing to make it safe and have other people actually apply it. How does that fit within the realm of like the athletic trainer? I know that it's mostly done by the physical therapist today. Where does that fit within the scope of athletic training?
You know, athletic trainers are healthcare professionals, and they function under the guide of a physician. And so every state has different laws, and we have to follow our state licensure laws.
Right.
And so every state's very different. So I would just encourage the athletic trainer to look at their state laws and see if this is something that they are or are not able to perform. Have that discussion with the supervising physician to see if this is something that you can incorporate into your practice.
Right, great.